Hi, you guys. So you probably have heard the statement that I make things harder than what they are. There's so many clients that have said that, and I've seen it, right? I make organizing my material, what I need to study, harder than what it is. I make simplifying the information harder than what it is. Like I've had clients that will explain stuff and they'll explain it like in 50 paragraphs, what something simple, very simple is. For instance, congestive heart failure. When I think of it, I think of a weakened heart. And I think the goal is the opposite. Instead of weakening the heart, we're going to strengthen the heart. And the way we do that is that we get a drug that can make the heart more effective at pumping, like digoxin, because it's going to increase the force of contraction. So the heart doesn't have to do this, right? Because the more the heart does this, the more likely it's going to wear out itself, right? And we don't want that to happen. We know in heart failure, the pipes get flooded or backflow, right? And so medications such as diuretics is going to help clear the pipes, if you will. So again, we want to make it easier for the heart. They've had problems in understanding the rationales and the questions and what they're asking them. So often I will review a testing strategy with them. And my testing strategy encompasses talking about relationships, because often if you look at the questions, they're often asking you about relationships. Do you understand? For instance, do you understand the relationship between an age and a condition, right? Because I have you to circle the key words and make sure you're getting those, because what are they asking you? So we know age-wise, children are more likely to have asthma than they experience asthma instead of COPD emphysema, right? That occurs pretty much using the older population. Are they asking you about a medication and to another medication? So for instance, DIG and Lasix. Lasix is a loop diuretic potassium wasting. Well, we know that with DIG toxicity, they have an increased risk of developing DIG toxicity if their potassium is low, hypokalemia. Are they asking about medications and patient teaching, right? And so regarding medications, if they're on a particular medication, such as MAOI inhibitors for depression, we don't want them taking other antidepressant drugs, right? Because they can cause, interaction, hypertensive crisis, etc. Warfarin and aspirin, warfarin and herbals like your G's, your ginger, garlic, ginkgo, right? Statins and grapefruit juice. Are they asking about a procedure and what you do as a nurse? Well, bronchoscopy. That is more of a focus procedure. So therefore it causes for a focus assessment. What are you going to be looking for? Listening to their lungs. Are they having difficulty breathing? Pain, chest pain? How are their nail beds? Capillary refill? What's going on? So again, what is the relationship between one thing and another? And if you really look at that, as you're studying, you're not just studying and memorizing stuff, right? Because I'm about organize, simplify the information so that you understand it. You should be able to say in a minimum, maybe 1 to 2 sentences, what actually is going on, right? What actually is this medication? What is it indicated for? What are the side effects? Be able to really concisely pull out that material and to simplify it and so you can understand it in your term, because you are the student of your learning, right? And that's what I get all of my clients. They become a student of their learning, know what they need to do, what they need to study, what they can back off on, etc. How are they understanding the information? And then you want to apply it. One of my clients said, Tamika, when I went to my test, it was like no other. Except for a few, I knew what the question was asking me. And I knew the answers to select. And what she said was true, evidently, because she passed with minimum questions. One of my other clients said, Tamika, I just kept thinking about what you said. Relationships. And that's what got me through. She passed again, didn't have to take the full exam. One thing I've said, you don't have to take the full exam, right? You just need to prove that you are competent enough to take care of the people that need you the most. So you can do this. I have a President's Week sale going on, 25% off my notes. I've been sharing my notes as a way to give back to the field of nursing and how it's been good to me. Healing, on also so many levels. You can find out on my website, but also to just to show you how to organize your information, how to simplify it, how to understand it, how to apply it. And I'll be sharing more of that, my testing strategy, and putting some more notes up. So watch out for that, including pharmacology, I was a student once, I taught it, and I help my students to understand it, right? Because it's a subject that can just send your mind in boggles. So I will talk to you guys soon. Take care of yourself. You can do this. Understand the information so that you can apply it, not in just the people's words or the people that teach you, but in your words so you understand. That's the key of not only passing your test, but also being a great nurse. I'll talk to you guys soon.